Welcome to our webinar, which is all about how marketing can solve recruitment challenges within healthcare businesses today. And also we're going to be talking about growth and marketing generally. So just to introduce myself and my guest today, my name's Jo Edwards. I'm Managing Director here at JE Consulting. For those of you that don't know us, we're a full service marketing agency supporting the healthcare sector and work with lots of clients who are based around the UK. I'm delighted to be joined by one of our clients today, which is Tinga and Sam from Nexus Care Services. I'm going to come to you in just a second. And also by my colleague, Tom. So Tom, could I just ask you to introduce yourself?
Yes, certainly, Joe. So I'm Tom Mason. I'm Communications Director at JE Consulting. Handle PR, comms, copy, content, marketing strategy for a wide range of clients. I've been working with Nexus for the last few years to help them develop their marketing approach.
Thanks a lot, Tom. And I'm not going to do the introductions for Tinga and Sam. I'd like you to introduce yourselves and just give a bit of background on your role in the business and what sort of business Nexus Care Service actually is.
Into this podcast, Joe. To be honest, my name is Tinga. Tinga Omera. I'm the managing director for Nexus Care Services. We provide private home care services to people in the local community that want to stay at home.
My name is Samuel Court. I am one of the sales directors at Nexus Care Services, focusing on business development and reaching as many people as I can in the community to ensure they receive the best possible quality care that they all deserve.
Fantastic. Well, thanks very much for giving up your time this afternoon to join the webinar, Sam and Ting. I'm really grateful for that because I know how busy you are at the moment. So we're going to run this webinar very much like a fireside chat. Let's keep it nice and informal and relaxed. To all of our guests who've joined us, if you'd like to put any questions forward to either myself, Tom, Tinga or Sam throughout this fireside chat, please do so. Just use the Q&A option on your Zoom toolbar and I'll keep a watch on that question box and we'll try and answer any as we go along. We're scheduled to run for about 45 minutes and we are recording this webinar. So if you want to recap on anything, we will make this available afterwards as an on-demand recording. So let's get into the chat. What I'm going to ask first of all to Tinga and Sam really is to tell us really what was the vision behind your marketing approach in the last 2 years, which I know from conversations we've had kind of substantially changed in those 2 years. And what have been your real targets and objectives over that time?
I think it's important, Tinga, that you share the story as to how you met JE to start with. Because I think that's an important aspect of our marketing strategy over the last few years, isn't it?
Yes. The business started in 2020 and we've been always good at what we do in terms of providing private home care services to people. The marketing we had wasn't giving us the results that we need. And I bumped into one of the directors for JE Consulting, and in a normal conversation, we just talked about what we do, and he told us that they provide marketing, and that formed the foundation of where we are now because he introduced us to Joe and the business as a whole, and they were able to engage with us very quickly. And at the time, we were kind of a best kept secret within our local community. We were very good at what we do. But nobody knew about us.
Mm-hmm.
Nobody knew what we do. In terms of the commissioners, they were not fully aware of our services, and we didn't know how to increase or expand our market share or what kind of audience to target to be able to get effective results or structure certain funnels to get constant referrals that allows our business to grow. And when we met with JE, they were very, very quick to deep dive into our business, understand our objectives, which is we wanted everybody to know how great we are and what we do. We wanted to expand our brand and we wanted to increase our market share and in turn our revenues as well. and they were able to create a plan for that.
I think it goes back further than that as well. So pre-COVID, we've grown exponentially during everything that happened with COVID. We were very good with word of mouth referrals. But we didn't know how to take Nexus to the next level. You know, lots of people in our community knew about us, but naively, we were very good at what we do in providing care and the sales aspect and recruitment, but we didn't know how to elevate marketing and realize that word of mouth just wasn't enough anymore. And that there was the world of social media, Google SEOs, and things that we hadn't explored, tapped into. And I think what was really good about working or being approached in collaboration with JE is that tailor-made package to help us do all of that, and then let us actually then focus on what we're really good at, which is providing a good quality care to people.
Yes, and fast forward into present, being that tailored package and servicing and marketing and brand awareness is actually helped us a lot into one of the most recognized brands within our local community.
Okay, well that leads us nicely onto brand, actually, Tom.
Yeah, it's a really good point to raise. So yeah, let's have a look at brand and kind of how it's grown in the last few years. So I guess the first question is, how has Nexus Care evolved in this period in terms of its brand presence and recognition within your market?
I think hugely. So as Tinga mentioned, word of mouth, people know about Nexus, but we hadn't quite established our brand. And that was one of the things that when we first came on with JE, we kind of stripped everything back and said, right, let's start from, the beginning. Let's start from, getting logos sorted and branding sorted. Yeah,
logo and
absolutely. So I think we've evolved hugely from developing our brand and becoming more recognized, and then moving forward consistently with that.
Yeah, and we didn't understand fully what goes into a brand, and effectively it's your image, your face out there, and it represents you in every way. And JE were able to help us package that and design a good brand. In addition to that, they were able to help structure all our services in terms of awareness and in services that we provide to make sure that what our brand represents is exactly what we do. And it was very specific and niche to our clients, which is now, looking back, we were quite small at the time, but now we're one of the top 20 providers in the West Midlands in terms of care services.
I think what we also did with the brand as well, I think what was great when we first started with Jay, they took the X in the Nexus, didn't we?
Yeah.
And that forms part of our brochures, our logos, and just being quite creative and clever with the actual name.
Which incorporates what Nexus means, which is where things meet. And that's why they took the X.
The center of everything.
Yes.
That's brilliant. You've had a lot of success with awards and also getting into industry publications. So how has that helped your brand? What role have public relations and industry awards played in boosting your profile more widely?
I think it's taking a small family-run company from just that into something a lot bigger, which we wouldn't have been able to have done without the submissions and the support in the award entries. And I think it's been testament. So over the years, we've been recognised as kind of finalists in certain categories, and now recently we've actually won various different awards. So we won the regional Great British Care Awards. We've been finalists. We've had 2 people finalists of the 30 under 30 at the NEC Care Show. We've had Dignity Champions, winners from State. And all of that wouldn't have been possible without the support and the admissions in order to do that. But in terms of boosting brand's profile, hugely, Tinga regularly speaks to commissioners with CQC, local authorities, and we just seem to have a bigger presence now, don't we?
Yes, we do. In addition to some of the awards that you mentioned, we've recently, in 2025, been nominated as Small Business of the Year with the Chamber of Commerce, which is amazing and represents how much of an impact we've made in our local community We are a winner of the top 20 providers in the West Midlands from homecare.co.uk. Again, that showcases how much done leaves we've jumped over the years in terms of awareness and just the general community. The awards have helped in building awareness.
But I think from a PR aspect, we hadn't done any PR before we collaborated with JA's and marketing, and we all see the pressures that the NHS faces, hitting crisis point of various hospitals, long ambulance waits, people waiting on wards, people waiting to come home. So from a PR aspect, I think they've hugely helped us hit the right channels of support and communication in hospitals in order to be able to showcase how quickly we can get people home, and also the difference that we're trying to make as a care provider.
We also do a lot of community initiatives that we don't always talk about in terms of our engagement with, for example, Good Hope Hospital, which is our local hospital, Sutton Park Run in our local community, Alzheimer's Challenge, the Alzheimer's Walk. All these we've been recognized in the awards for part of it, Community Unsung Heroes, which is in raising a profile and awareness in what we do, but also engaging in the community and also being part of the solutions that bother our community and just being able to give solutions.
But I think we wouldn't have had as much success had Jay not got the right contacts in the right areas to help support us to do that.
Yes.
I think that's important to note as well.
Yeah.
Great. Obviously, we can't ignore the influence of social media in our everyday lives. How has your approach to social media changed, and what impact has it had on Nexus?
Social media that well in NJE really helped us with that. We didn't understand the metrics behind the scenes, the demographics behind the scenes, the community engagements behind the scenes. So sometimes I'm not sure if we even understood what our customer or client segments were. And JE introduced us to social media and in raising awareness, in being able to look behind the scenes and understanding who's engaging with our content and how we can work on that information to refine our message and also acquire in client acquisitions so that we get more results.
I think it's also keeping up with the trends as well. What's really important, we are a bit kind of naive to TikTok and Snapchat and all that sort of social media. And I suppose it's more focusing on, we're a bit old school in the likes of Facebook. And I think what really helped me was Tom, I suppose, you helped us explain the right audience demographic. So in our industry, the people that we are targeting from a business perspective to help potential clients is the children of the actual person that needs the support. So although, as you previously mentioned, before we collaborated with Jay, word of mouth was really important. Actually, people spending it's hitting the right time on social media when people have perhaps finished 9 to 5 or they're scrolling of an evening, and that right audience demographic advertising. So social media for us has had a really big impact in terms of awareness, brand awareness, and I suppose it's keeping up with the trends as well.
And the feel good factor, we do a lot of amazing work. And anybody that is involved in our sector understand the impact that you make within the local community. However, that you want to share those stories, and social media has been an amazing platform that Jay introduced us to be able to share that with our community, and it has encouraged more engagement, more followers, and has allowed us to be able to influence and be part of the solution and the voice within our local community.
So
wonderful.
You mentioned, obviously we talked a bit about sort of digital social media. One of the strategies obviously that we've helped implement with you is digital advertising, and I'm talking specifically here for lead generation and client acquisition. We'll chat about recruitment shortly, but in terms of your investment into digital advertising for client acquisition specifically, How's the frequency and quality of that lead gen changed for you over time? And what sort of specific digital advertising strategies have you put in place?
I would say that most of our digital strategy has been on one, targeting the right clients. We were
Yeah.
not aware who was our client or customer is, and the lead generation and being able to refine all the content and metrics that in the background that engage with our content has allowed us to refine that customer segment. And in the past, most of our business we were getting through word of mouth. However, I would say 60% of our business was coming from word of mouth at the time, which has now changed. Lead generation now generates 60% of our business through digital marketing. And this is something that we didn't understand. It's an untapped source or power that we could use to enhance our business and grow.
I think it's the quality of the lead that's been really important. So it's making sure that the right, I suppose, SEO is in place and the right sort of advertising and wording and constantly keeping up with what the industry is looking for and what people are looking for. And that's what's really important. It's what people are looking for. It's particularly in our industry of providing support to the elderly and vulnerable. It's the keywords and making sure that people that are calling up, I suppose, are not just fishing for information, that they are genuine leads that are looking for the actual support, and that allows us then to turn that lead into a conversion via an assessment and then becoming an actual client. So for me, what I've noticed is the quality of the leads that's become important, or more so important.
Yeah. I know you do a mixture of obviously there's organic search engine optimization, bringing traffic to and searches to the website. There's a bit of Google paid advertising in there. There's a bit of social media advertising in there. How important do you think it is to have a good mix of all of those things working together? And how do you really manage the ROI from the different aspects of that? Because ultimately they're all coming, I guess, to the website.
I think it makes you pay more attention to the process of it.
Yeah.
Before, as mentioned, we used to spread. We'll just put as much content out there, hope he engages with someone, and hopefully they like us. Now we understand the importance of messaging and trying something organically and understanding who engages with it and using that data or information to then lead into a sponsored campaign and being able to track those metrics in terms of the process and the journey or the funnel of who's engaging in terms of PPC conversions or SEO optimization, to see who then goes through the funnel and what are the delays within the funnel, if anything needs to be refined within that, to be able to actually acquire or convert that person or that client into actual services that we provide. The biggest lesson we've learned here in using the different strategies is the process of it. JE have been able to structure that for us in a way that we clearly have a clear process of funnel that we follow, and it keeps growing and growing in terms of the return on investment or results that we get.
Okay, so obviously the strategies there for client acquisition. That kind of leads us on to the second challenge of any healthcare business, which is recruitment and talent retention. Tom, I know you've been heavily involved in this. Do you want to take the lead on some of the questions there? You're on mute, Tom.
I'm sure many people of you who are on the call today know the challenges that the care sector faces at the moment in terms of recruitment. It's a perpetual issue within most organisations, and was a big focus for Nexus when they came to us. So, Tina and Sam, what have been the biggest challenges in recruitment for you in recent years?
I think the single most biggest challenge is that we are in an aging population.
Yeah.
So people are living longer, and with the advancements in medicine, that's helping them to do so. So if you've got there is more supply, there's more demand than physical supply. So there are more people in our community, in our country, that need support than there are physical carers. So for us, because we're quite niche in our quality of recruitment, make sure they've got the right caliber of carers with the right experience, to meet all of our prerequisites. We struggle to ensure those pool of high quality candidates continue to come through when there is such a finite amount of carers in the industry itself.
Yeah, and to clarify on that as well, pre-COVID, we didn't have much of this problem, but I would also say that we were quite small at the time. And what's so important to us is the quality carer, someone who wants to do the job as a vocation, and understand the benefits and the career progression that comes with it. And in the industry, we've struggled so much post-COVID in attracting that talent or keeping up with the growing demand for services to manage capacity. And JE have been part of that solution too.
Yeah, that leads quite nicely on to just, I mean, how exactly has marketing supported your recruitment efforts? And are there any kind of specific campaigns that you can call upon that kind of demonstrate how that's helped?
I've got a few, but I'll start with the few good ones, which is the image of care has not always been glamorous. And it was important we showcase how it is a vocation, how people progress. We have carers within our business that have started from just a carer and are now directors within the business. So people can grow and you take care as a vocation and develop within that. And it gives you all the qualities to become whichever ambition you want to do. And JE, help us with the Carer Spotlight, where we publish few good stories of what our carers do. And what that does is helps people interested to join the sector to want to be part of it, because they understand the impact they make in people's lives and the community, and also people working within the business to be more motivated and want to do more because they can see real examples of people within the sector making a difference. So that's one of the most amazing things that we've managed to do. Anybody can go on Indeed and put an ad, but showcasing the qualities of what the job does is amazing.
And the real life success stories, I think our social media page has hugely helped that. I think without becoming too, I suppose, corporate or using stock images or anything like that and our advertising, it's, I think, showcasing real life success stories of our carers has hugely helped, like I said, with the image that the care can often have as being perceived. I think it's also, in a very demanding and competitive industry, it's trying to showcase what we do for our team that's been really important. So not just about pay, but like you said, about career progression, and the career in care, is a vocation. It's not just a job. So it's trying to, for us, it's trying to change that perceived image that I think has been a really but recruiting consistent high quality carers.
Yes.
That's great. I know we've already touched upon it already in regards to digital ads and digital advertising, but how have these innovative marketing techniques supported the increase in your pool of potential recruits?
It's allowed us to, like as mentioned earlier, we have a challenge in terms of the growing need of care. So workforce is, in terms of recruiting the right talent and retaining it, is always a challenge in our sector. But in our numbers, we are seeing more, and we are able to retain more talent when they join, able to showcase and target the right people who want to be part of our journey and what we do and the culture that we develop here at Nexus. And these innovative ways of showcasing that really, really helps structure that and tell the story of somebody interested to join the sector.
I think touching on that as well, Tingy, it's reaching a wider demographic of ages that's I think it's really quite important in being innovative. So it's perhaps people that are, just coming out of school or college that are looking to get into career of care, looking to kind of dip their toe into the industry. But then also the other end of the age demographic of people that perhaps that have had a career in care, or they've been in the NHS or care homes that are looking for a different style of or support. It's definitely reaching all age ranges and demographics to help.
And within our business, we offer apprenticeships for any carers that want to develop and grow. So, like what Sam mentioned, being able to approach the younger generation, because predominantly within the sector, we have a lot of female carers, we have a lot of older carers, but the growing need requires more people to join the workforce and attract the younger generation, and being able to offer comprehensive training and development and career opportunities and marketing those as part of our recruitment strategy and innovation has been really, really useful in getting the right talent on board.
That's great.
So I was just going to get down to the nitty gritty here, Tom, because we've obviously talked about, what's kind of been happening on the lead gen front and the recruitment front. I guess the question from a lot of people watching today will be, well, how has that really made a difference to your financial and operational growth? Yeah. So you've focused on brand awareness. You've implemented lead gen strategies. You've implemented recruitment strategies. What's been the outcome as a result of that? Without giving confidential information away, absolutely. Yeah.
To put it simple, we've been able to maintain a 20%, over 20% year-on-year growth in terms of our revenues and client acquisition within the business. And that's amazing in this climate to be able to acquire that and retain and develop a remarkable reputation and award-winning service.
Definitely. Yeah, I agree. I think it's more I think the holistic approach to marketing as well, has helped us financially, hasn't it? Like you said, it's more of the award wins, the recognition, the brand awareness, all those things, like I said, have helped us grow year on year and exponentially as well. And we've only got further ambitions with Jay this year to hit new heights and further client acquisitions and more inquiries. And the demand is on these guys to generate more and give us more so that then we can help do that. So absolutely, we are we're not stopping in this industry, and we want to further our reach, our areas. And yeah, definitely. So
yes, and the financial success has also allowed us to be able to gain more resources, to reinvest more resources, and to focus on exactly what we're good at, which is providing quality home care services to people who needs it, and marketing initiatives, being able to have a company that helps and works as an extension to your business has been really, really priceless.
So do you think that's had an impact as well on how you engage with what I would call, referrers, influencers, in your case, care commissioners, with the wider kind of market influencers? What impact has that had?
Absolutely. We've been able to showcase we are part of the solution. Right now, we are in the middle of winter pressures, backlogs within the NHS ambulance services. The system is overwhelmed, and being able to showcase and have dialogue and be part of the table, or to have a seat on the table and say we can do or have solutions for you for your discharge services. We can assess very quickly, or we can help people stay more at home without the need to be referred into hospital. Has been really, really useful.
But I think it's helped your relationship in particular with council commissioners
Yes.
and our CQC governing body
Yes.
commissioners. And then from my perspective, our relationships with social workers in the community and other healthcare professionals, occupational therapists, physios, district nurses that have all heard about Nexus. So when I suppose they're trying to help somebody with a placement of care and they have heard about us through one avenue or another, that only further heightens our recognition and gives a potential client, I suppose, already have a rapport and trust before we even met them because of the brand that's been built.
The referral pathway has been phenomenal, and that's good. And getting that endorsement from client service specialists within the sector there's no bigger influence than that.
Yeah, that's external. Tom, did you want to kind of touch on the impact internally?
Yes, Joe. So I guess the other part of marketing is how people within your own organisation perceive you as well, which is obviously really important in retaining existing talent. So how has the success of your marketing strategies affect the way your team perceives their own work and also the company that they work for?
Ownership, brand, and culture has evolved. We now being part of the Nexus team, our team are very proud to represent the brand, to be part of an award-winning service, to be part of a company that is part of the local solutions. So being able to be part of something bigger and that keeps growing has really helped internally with our workforce that feel pride to be part of what we represent.
It is, but I also think Jay have helped us with our own internal messaging that I think is important, and always kind of keeping to our values and beliefs and why we started Nexus and what it stands for.
Remember when we did the 5 service promises?
Yeah. I think the graphic design team helped us develop. We've got a service promise upon our office that reminds the team every day why we do what we do, and ultimately those that we look out for. So internally, it's showing all what Tina said, but reminding the team who we are and what we stand for as well.
That's wonderful. Thank you. Joe, I thought you had some closing questions for Sam and Tinga.
I do. And what I'm going to do is I'm just going to open up in terms of questions that we might have from anybody that's watching. Feel free to put them in the Q&A box at this point. But I have some questions for you just to close off, really. For anybody watching this, whether they're watching it live today or they're watching it on demand, I think my question to you is what do you hope are the key takeaways that anybody watching the webinar will take away with them after today's discussion?
That don't underestimate the impact of marketing and elevating your business. So I think we're a real life example of that, where we knew what we were good at and we relied heavily, I suppose, on word of mouth, but neglected the impact that marketing could take us to new levels, which is when we collaborated with Jay at the right time, where we knew we wanted to grow further but didn't know how. And I suppose it's letting the experts in, with yourselves and your contacts do work so great to help companies to grow. So it's more teaching and understanding it all at the same time.
Yes, and in addition to that, being able to be part of a marketing team that feels like an extension of your own business. I don't think there's anyone in JE. I don't know. I understand their roles, exactly what they do, how they collaborate and play a part in our objectives and our roles. And that's been really useful to have an extension of our department. Whilst it looks outsourced, to us it doesn't. It feels very internal, and that's what you're looking for from a marketing company. Someone that, or a company that is very much or integrated into everything that you do.
Okay. I do have one question here. Is there a particular social media platform you think works better for recruitment?
That is I would say Facebook is always a gem. It's overwhelmed, but it's got a lot of hidden communities within that. There's a lot of messaging. Content is forever changing and creative. So as long as you got a good marketing team that able to work with that is really useful. LinkedIn is an untapped talent for our sector, so we're still trying to evolve with it. But Facebook has been really, really useful in building our recruitment results more.
I think Indeed's been quite good as well. Indeed's been a good platform.
Yes, it actually Indeed has been as well in terms of but I think where JE has helped us is in refining our message and our ads. I remember I wasn't even aware of is it Glassdoor? And I remember Tommy introduced us to Glassdoor, and it was amazing to hear what other people think about our business and the reputation behind the scenes. It was amazing. Homecare.uk has got a recruitment platform there. We've got a 10 out of 10 review on home care. These platforms have also really, really helped.
I think a variety of platforms is important to like you said, to hit a variety of different demographics and ages.
Absolutely. I would say to any company who study the data and understand what works, but work with the right marketing team that understands how to mine that data.
Perfect. Thank you. Well, I want to say thank you to Tigger and Sam for giving up your time this afternoon to join us on this chat. I'm really, really grateful, and thanks for being so open about how the business has achieved some of the results that you've had. I know you've got a very positive outlook for the rest of this year. We're hugely privileged to be part of that journey with you. We really, really enjoy working with you. So thank you for that as well. If there are any more questions, fire them through. We can pick them up on email afterwards and pass them over to Tigger and Sam if anybody's got any other questions. But I want to say thank you. We'll make this available on demand, and I hope you've enjoyed the webinar. Thank you.
Thank you very much.
Thanks, everyone.
Thank you.